On this Tuesday night, driving the message home to stay home. Don't even go to national parks.
Pretty much anything with a door will be closed.
The feds issue vital reminders.
Share. Be kind. Ask how you can help.
Why Ottawa hasn't invoked its federal powers. COVID-19 and your cash. The changes coming to EI and filing your taxes. Multi-billion-dollar bailout.
I felt it was a pandemic long before it was called a pandemic.
Washington's promise to every American. Plus, the push for more tests, more ventilators, and more supplies for medical workers.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
As much as possible, stay home. Don't go out unless you absolutely have to.
An extraordinary plea from Canada's Prime Minister to work together by staying home to help slow the spread of COVID-19. Good evening and thank you for joining us. Across the country, tougher measures are coming into force as communities face the growing threat of the pandemic.
COVID-19 constitutes a danger of major proportions. We must act decisively and we must not delay.
That's Ontario Premier Doug Ford today declaring a state of emergency. And BC and Alberta have declared a public health emergency. In Ontario and Alberta, gatherings of more than 50 people are banned. In Ontario, restaurants and bars have been told to shut down. The move comes after Ontario's first death from the virus. A man in his 70s from Barrie. BC announced 3 new deaths today. That brings the total number of deaths in Canada to 8. In terms of total infections, the situation is changing quickly. Over the last week, the number of cases has grown steadily in Canada, and it continued to climb today. As of tonight, there are more than 570 cases in Canada, including those who have recovered. BC reported a major spike today. 83 new cases, bringing the total to 186. The other provinces with the most cases are Ontario, Alberta, and Quebec. The 6 other Canadian provinces have all detected the virus. The Prime Minister says his government is considering emergency measures to better tackle the pandemic. For now, he's asking Canadians to do their part by staying home. Mike Armstrong has tonight's top story.
There is no question what the Prime Minister is trying to convey, a delicate balance of calm and concern. The country's healthcare system at this point, he says, is strained but strong.
Whether you're a doctor or a nurse, a hospital administrator or maintenance staff, you are doing an incredible job.
This is a stressful time for everyone.
There may also, understandably, be some strain on politicians. It wasn't hard to hear the emotion in the voice of the federal health minister as she appealed to Canadians to help each other.
Make sure that you're kind to one another. Check in with vulnerable people by phone. Think of ways you can help to ensure that we get through this together.
The main focus continues to be on flattening the curve, cutting down on transmission. To keep people home, as of tomorrow, the federal government is shutting down all national parks and all heritage sites.
What this means for our parks is that pretty much anything with a door will be closed.
The issue of the door into Canada is still being debated. Ottawa is closing the border to most of the world effective just after midnight, but not to Americans. The Deputy Prime Minister says the border is a lifeline to both countries, moving goods, medicine, and workers, but she's heard the criticism.
We're very aware that the situation for British Columbia is particularly acute, and I had a long conversation with Premier Horgan about it last night.
We have to slow down the spread of COVID-19.
The Premier of Ontario is declaring an official state of emergency. Much of the province is shutting down nearly everything other than grocery stores and pharmacies and restaurants that do takeout or delivery. Ottawa isn't going quite that far. It has not enacted the Emergencies Act yet.
It is a very serious step.
3 different federal ministers referred Tuesday to the Emergencies Act as a, quote, last resort, saying they hope we don't reach the point where it's needed. Mike Armstrong, Global News, Ottawa.
Canada's Emergencies Act would allow the federal government to declare a public welfare emergency, and that would give the government sweeping power to lead a national response to the outbreak, like restricting the movement of people, regulating how goods and services are distributed. It also allows the government to set up emergency shelters and hospitals. It was formerly known as the War Measures Act and was used during the 2 world wars, including to censor newspapers and religious groups. Prime Minister Trudeau last invoked it during the 1970 October crisis, when members of the Front de Libération du Québec kidnapped the province's deputy premier and a British diplomat. The federal government is expected to unveil an emergency stimulus package tomorrow to help Canadians get by and keep the economy afloat. Global News has learned key details. Let's bring in Global's Couteur in Ottawa. Mike, what are you hearing?
Yeah, Robin, we have learned that the economic stimulus package presented by the government Wednesday will be worth between $20 and $30 billion. It's a massive figure that gives us an idea of how significant the government thinks the overall need could be, and perhaps how long Canadians will require financial support. Now, the announcement will be made by the Prime Minister, and then additional details will be laid out by the Finance Minister, Bill Morneau. Justin Trudeau has been leading meetings with key cabinet ministers for the past few days in order to come up with this plan. We're also hearing that the deadline for filing your income tax returns will be extended by 1 month, meaning you'll now have until June 1st. Now, businesses are also being given an extra month, so their deadline will be July 31st. But some business owners that we spoke to today worry they won't survive if more sweeping measures aren't brought in by all levels of government. Lindsay Thompson and Jonathan Bonney have run the King Eddie in Ottawa for 5 years. There have been a lot of ups and downs in that time, but this is nearly rock bottom.
Obviously, our biggest fear right now is just maintaining a clientele, paying the bills, being able to keep the virtual doors open, so to speak.
Virtual doors because the province of Ontario is closing all dine-in restaurants and bars. Only takeout and delivery are allowed, which means wait staff will be scaled back.
Obviously, we are anticipating that this would, be inevitable. So at least now today we can go forward and inform our staff what this means.
Ontario Premier Doug Ford knew workers could be severely impacted by his decision to close bars and restaurants across the province. While his government is putting together a financial stimulus package, Ford is leading a chorus of premiers urging the federal government to step up and help workers.
It's essential the federal government gets moving on the EI, instant EI for people that have been laid off.
And if the federal plan isn't finalized yet, BC's Premier has some suggestions.
They need to make sure that they're not shortchanging people in this crisis. It's a go big or go home environment, it seems to me.
BC Premier John Horgan says he's confident the Prime Minister understands that, but he says there is a sense of urgency now because his government can't make a move on worker compensation until he knows what the federal government is doing. Robin?
Mike Couture in Ottawa. Thanks, Mike. The Canadian Army is cancelling its largest training exercise of the year due to COVID-19. Exercise Maple Resolve is now off, so the military can protect troops from the new coronavirus and keep them ready to conduct operations when required. The exercise was scheduled to be held in Wainwright, Alberta in May and was planned to prepare troops for deployment to the Canadian-led NATO mission in Latvia and Ukraine. Armed forces in Wainwright live and work in extremely close quarters. In the U.S., the number of confirmed cases of COVID-19 is climbing as more testing, which was initially limited, is carried out. Over 5,000 people are infected. Right now, the White House is weighing a massive emergency rescue package, which could see Americans receive cash payments within 2 weeks to combat the economic cost of the outbreak. Jackson Proskow reports.
7 million California residents awoke to their first day under lockdown, told to stay home and shelter in place. While America's largest city, New York, weighed similar measures as daily life continued to fade from view, with empty streets, bars, restaurants, and businesses closed.
You can imagine everyone that works here depended on this job, and to not have that now is tough.
Normal may not return anytime soon. The governor of New York issued a dire warning that COVID-19 cases likely won't peak for at least 45 days, overwhelming the medical system.
They are expecting as many as 55,000 to 110,000 hospital beds will be needed.
As states called for a coordinated federal response, the president struck a more determined tone and walked back his earlier attempts to downplay the seriousness of the virus.
This is a pandemic. I felt it was a pandemic long before it was called a pandemic.
The White House is promising a massive economic recovery package, bailing out airlines, hotels, and businesses, and offering assistance to every person in the U.S.
We're looking at sending checks to Americans immediately.
Amidst the crisis, some states are pressing ahead with business as usual. Large states like Florida and Illinois pushed ahead with voting in the presidential primaries, fearing there may not be a better time to hold them. Jackson Proskow, Global News, Washington.
Canada is testing for COVID-19 more widely than many countries around the world, including the U.S. But now, according to the BC Centre for Disease Control, BC is facing a limited supply of swabs used to test for the virus. It's a critical tool in the fight against the pandemic. As Eric Sorensen reports, the results give health officials crucial information about the behavior of the virus.
At the height of the COVID-19 outbreak in China, it's now believed most cases were missed. Those with milder symptoms may have stayed home and were not tested.
Hi, can I have you step out of the car, please?
Other countries are at that stage now. A new study suggests for every confirmed case, 5 to 10 go undetected, and that mild cases are responsible for spreading the majority of new cases. It's why the World Health Organization is emphasizing the need to know who has the virus.
We have a simple message for all countries: test, test, test.
The high standard is South Korea, which tested almost 3,700 per 1 million citizens and has limited the spread of the virus. Italy started late and has tested just 826 per 1 million last week. At the low end, the United States, by last week, had only tested 23 per 1 million Americans, which could mean numbers there are mushrooming undetected. In this country, a jump in testing to almost 37,000 now, or about 982 per 1 million Canadians. There have been cases in Canada where people with symptoms were not tested because there was no foreign travel or contact involved.
Travel history being a major risk is becoming less and less relevant, given that we have clear local transmission going on here in Canada.
As part of a $300 million relief fund, Ontario plans to expand testing.
We're backing up our frontline public health workers with more resources for monitoring and testing.
Experts say diagnostic centers can do more tests while not overburdening hospitals.
I think that's really important because we probably will be seeing increased case numbers at the hospital. And if we can do anything possible to keep people that just aren't sick enough to be in hospital out of the hospital, we're doing something right.
More testing may cause COVID-19 numbers to spike, but it will also paint a more accurate picture of the crisis in this country. Eric Sorensen, Global News, Toronto.
It's the first day of a nationwide lockdown in France. That country has nearly 7,700 cases of COVID-19. People are only allowed to leave their homes for specific reasons like medical needs, shopping for groceries, or essential work. 100,000 police officers are patrolling. In Italy and Spain, the situation is growing more grave. The total number of people with COVID-19 in Spain has jumped by nearly 2,000 new cases in a single day to more than 11,000 cases. Italy has nearly triple the number of cases with more than 31,000. 2,500 people have died. Coming up, fears Canadian hospitals don't have enough ventilators. For those critically ill with COVID-19, ventilators are the difference between life and death. Several provinces have ordered more, but as Heather Yerkes West reports, there are concerns suppliers won't be able to keep up with the soaring demand.
We're ordering and we are taking all the strategies.
In Quebec, provincial health officials offered reassurance Tuesday that if patient demand on hospitals were to rise because of COVID-19, the medical system would not be short supplies.
We are really having a lot of help from companies, and so I want to reassure that we should have what we need.
Across the country, health systems are looking at how to expand capacity, particularly in intensive care. Italy has seen demand for critical care beds soar, and with them the need for ventilators. Health experts warn that if countries are unprepared, people will die.
Certainly in the more worst case scenarios, it could mean things like triage decisions around who gets a ventilator based on who is more likely to recover.
Several provinces have additional ventilators on order. Manitoba is awaiting 20, Alberta 50, while Nova Scotia has ordered 140 new units, a number that would increase its supply by 60%. But Canadian hospitals will need to compete for these resources with a growing global demand, and suppliers have warned they may not be able to keep up. It's why the British government has reached out to companies like Ford, Honda, and Rolls-Royce to help make health equipment. Canada's federal government is looking for help as well. The Canadian Chamber of Commerce CEO tweeting Tuesday, "Are you a manufacturer who can retool to manufacture critical medical equipment? If yes, the federal government wants to hear from you."
We need to mobilize all of the resources that we have in Canada to be able to respond effectively. So far, certainly what I've been hearing from members of the business community is that where they have the capacity to do so, they're glad to make their contribution.
Wartime-like efforts in the global fight against COVID-19. Heather Urix, West Global News, Calgary.
Still ahead, can Canada's medical supplies keep up? The new coronavirus has brought with it a desperate need for medical supplies like gloves and face masks to keep Canadians, but especially frontline healthcare workers who are extremely vulnerable, safe from contracting COVID-19. Tonight, our Ross Lord looks at how prepared Canada's healthcare system is and whether it has enough resources to cope.
This how-to video for Nova Scotia healthcare workers is aimed at simplifying personal protective equipment.
Now you've got your gown on and you've got your facial protection on.
The next video from the same health authority is troubling. Protective equipment is going missing from Nova Scotia hospitals at an alarming rate.
And what that means is that people are taking masks and other protective equipment out of the organization.
There are similar reports from other provinces, and the timing could not be worse. Masks and gowns can keep co-workers from catching COVID-19 from their patients, a possible source of infection in the case of a care worker at North Vancouver's Lynn Valley Care Centre. The federal government says it's pursuing suppliers of everything from masks and gloves to laundry services and IT support.
As well, of course, we're readying all those systems that we've talked about, the laboratory systems, the surveillance systems, protecting our health workers, very important.
The World Health Organization admits there's a global shortage of protective equipment that's leaving doctors and nurses dangerously ill-equipped. But provinces prefer reassurance.
And we're purchasing more personal protective equipment like masks, gloves, surgical gowns for our nurses, doctors, and personal support workers, as well as more ventilators.
A national union for nurses says it's not enough, insisting members need more say in their level of protection because methods like social distancing don't apply.
Have you ever seen a nurse or a healthcare worker do a treatment with over 2 meters? We're very, very close.
It's easier to agree on this point. For a country in uncharted territory, providing enough safeguards and using them properly will be a challenge. Ross Lord, Global News, Halifax.
Can you get COVID-19 more than once? Up next, experts answer your questions. Coping with this pandemic is very stressful for many Canadians, and it shows no signs of slowing down. There are a lot of questions around COVID-19, and you've sent many of them to us. Our Jeff Semple has gone to the experts to get some answers. Jeff, social distancing is a big topic of discussion. What are people saying?
Well, Robin, by now, Canadians have heard the warnings to avoid large gatherings. So no sporting events, concerts, or St. Patrick's Day parades. But what about the smaller stuff?
Hi, my name's Jason Miller. I'm from Edmonton, Alberta. We're having a bit of an argument in our household. My wife doesn't want us to go anywhere. She doesn't want our kids to go out to visit friends, to go to the gym. Obviously, that's closed now, but I'd be curious to know what your thoughts are on that.
We've been told time and time again, don't congregate, avoid the places where people congregate, work from home. Schools have been canceled. The NHL's been canceled. I mean, what more signals do people need?
And speaking of keeping your distance, we've all seen those images of shoppers crowding stores and stockpiling supplies. That's prompted one viewer to write, noting this seems like the perfect setting to increase the numbers of people contracting this disease, should the stores limit the number of customers going in to shop. The answer? Yes. Proskow and Shoppers Drug Mart are among the retailers now taking extraordinary steps to limit the number of customers allowed in the store and the quantity of supplies they can purchase at one time.
Hey Jeff, this is Ken Martin in St. John's, Newfoundland and Labrador. Wondering if you could ask your medical experts to talk a little bit about the good news and the stats, the people who are recovering, people having mild symptoms.
There have been around 200,000 reported cases of COVID-19 worldwide. Nearly half of those have already recovered. And in the vast majority of cases, the symptoms were relatively mild and manageable.
As long as it's mild and it's going away, camp out at home for 14 days, wait for it to pass, and then hopefully you've had this.
Another viewer emailed us to ask, if someone gets the virus and then recovers, can that person become infected again?
We don't know the answer to that yet.
Those experts admit that the answer to many of these questions is that they still don't know. This outbreak is still in the early stages. As one of them put it, we're now at the end of the beginning. Robin?
Jeff Semple in Toronto. Thanks, Jeff. We know you have lots of questions about this virus. Jeff will continue to consult with experts and try to answer them. So email your questions at globalnews.ca. On our website, you'll find a special page dedicated entirely to the new coronavirus. That's at globalnews.ca/coronavirus. And that is Global National for this Tuesday. I'm Robin Gill. Tonight, we're looking at new ways to celebrate St. Patrick's Day. Bells rang out over empty churches across Ireland, sending out messages of hope. Parades were cancelled, but virtual ones kept spirits high. Thank you for watching, and I'll see you back here tomorrow. Good night.